Hi to those who have just joined us. We'll just give it a couple more minutes so everybody can join, give a chance to join us.
Hello, everybody. I think we're waiting on quite a few more just at the moment, aren't we?
A couple of minutes to go. So we'll just give it one more minute and then we'll start promptly at 2.
Hi, everybody just joining. I've just noticed a few more people join. We're just waiting on just a couple more. We'll just give it another minute and then we'll start. Okay, I think we've got a few more people waiting to join, but I think if it's okay, we'll just start off the session. Otherwise, we're going to run over too far and don't want to keep you too much longer. Hi, everyone. A huge big welcome to today's webinar about lung health, a better night for a better day. Thank you all so much for coming along today. Before we start, I just need to read a disclaimer. So this presentation is a corporate presentation from Atos Medical Group. Nothing in this presentation provides any diagnosis, clinical advice, indication, guide, warranty or guarantee. Nothing in this presentation can substitute individual advice or guidance from a qualified healthcare professional. And you must see a clinician or qualified caregiver for advice on your condition and on products that may be appropriate for you. So my name is Jaime, and just above me in the photographs on this next slide is Kathrin. She's lovely, Kathrin. We're part of the Atos Head and Neck Nurses. If you have any questions at all during the presentation, please write them in the Q&A at the bottom or on the side section, and we'll answer them at the end of the session. Okay, let's get started. So we're just going to start the session off. We do love a poll. It's quite a good sort of to gauge things. So we're just going to start a little poll, and it's how long ago did you have your laryngectomy surgery? I'll just give you a few seconds just to answer that. Okay, we're just waiting on the results. Oh, okay, so we've got quite a few, quite a big difference here. We've got quite a few people that have had 5+ years, and only a couple that are less than a year. So it's quite good to know we've got sort of quite a range here, but quite a lot sort of that are more sort of advanced on in their journey. So that's great. Okay, so what I'm going to do now is just hand over to Kathrin, who'll just take you through the next part of the session.
Sorry, Jamie, I forgot to take myself off mute there. Hi, everyone.
Okay.
So let's have a look at the importance of sleep then. Next slide, please. So getting a good night's sleep every night is crucial for our well-being. It prepares us for the day ahead. I'm sure we've all experienced waking up after not sleeping very well and had that horrible feeling that you just don't have the energy to face the day and you just want to crawl back to bed. Well, a lack of sleep in the long term can leave you feeling this way on a daily basis, leaves you feeling very tired and can have an effect on your motivation, which then can have an effect on your emotional well-being and also on your immunity, believe it or not. Next slide, please. So some of you who have attended these events before may have heard about a study which Atos Medical carried out in 2018. We wanted to learn more basically about laryngectomy care and quality of life. This study uncovered several issues which weren't really spoken much about, such as the impact of coughing and mucus on everyday life, but also the disruption of sleep. And from these results, we can see that nearly half of those involved in the study woke up due to coughing, and more than a quarter of them had disturbed their partner or other family members' sleep through coughing as well. Next slide, please. So we've got another poll for you because we do like a poll. So following on from what I've been just talking about, we'd like to find out how coughing affects you if you've woke up due to coughing. So I'll just give you a minute to submit your answers. Okay, I think that's probably enough time. Okay, so it's almost 50-50 really. In fact, 45% on the study actually showed that 48% of people had been woken due to coughing. So that actually ties in nicely, reflects those results, doesn't it? Next slide, please. Can we have the next slide? Oh, thank you. So what can you do to help reduce coughing and improve your sleep then? Well, wearing a HME day and night helps to improve your health and certainly your lung health as well. It reduces the amount of mucus you produce, which in turn then reduces the amount of coughing that you experience. And if we take a look at the next slide, this shows us more results from that study that I spoke about a couple of slides ago. And if you look at the graph on the left, particularly the red bar, it shows that 38% of those who were involved in the study back in 2018 said that they had a reduction of coughing after 12 weeks of wearing a HME both day and night. And the graph on the right shows that more than half of those that were involved in the study also saw a reduction of mucus over that 12-week period as well. Next slide, please. Another poll, I'm afraid. We like to have a breather. Oh, we go back a slide. So poll time again. Do you wear a HME at night? And if so, which one do you wear? And this is a two-part question, so I'm going to have a little breather while you answer. Okay, shall we see what the answers were then? Oh wow, you all wear HME at night. That's amazing, fantastic. And the 71% of you wear the Provox Life night, so that would be great. Be interesting to hear how you're all getting on with that. Fantastic. So can we have the next slide, please? Okay, so we're going to look more specifically at the nighttime HME. The Provox Life Knight HME is designed to reduce mucus and reduce coughing, and in turn help you get a much more restful night's sleep. Hopefully, as that 71% of you out there who are actually wearing the Provox Life Night, hopefully you're actually experiencing this for yourself, that you're sleeping better, you're coughing less, and your mucus is less overnight. Next slide, please. So the night HME is much softer than the daytime ones, and because of this, it's much more comfortable to wear at night. It's also got a higher humidification, so you shouldn't be waking up feeling as dry after wearing it all night. It's also a lot easier to breathe through and makes it much more comfortable to wear overnight. We've received some really great feedback from people who have been using the Provox Life Night HME, and we've got a quote on the slide here. So this person said that they have a totally different life now. They can breathe better, they sleep better, and they have much more confidence if they walk into a shop and need to cough. So that's some great feedback there. Next slide, please. So now we're going to play you a short video, and on this video, Louise is showing us his nighttime routine for changing his base plate in HME. So if we can play the video, please.
Hello. I am Louise. Changing the adhesive can be quite tricky, but now I've figured it out.
I think Louise gives some great tips there as well. I love the way he was fanning his neck dry with the packet as well to dry his skin first. Okay, so getting enough sleep helps you to be more active. It also helps to protect your mental health. During the sleep cycle, we go through light sleep, deep sleep, and REM sleep. The light sleep cycle accounts for the majority of our sleep, and it's responsible for mental and physical restoration. Deep sleep, this cycle usually occurs very early on in our sleep cycle. If you usually wake up feeling refreshed, it's most likely that you've spent longer in the deep sleep cycle. REM, not the music group, but rapid eye movement, is important for memory and mood. And I think we often worry if we've woken a few times during the night. I know I've commented quite a few times, I didn't have a very good night's sleep last night. I woke up 3 or 4 times. However, it's perfectly normal to actually wake anywhere between 10 and 30 times a night, but we don't always remember these waking moments. Next slide, please. So we've put together a few tips for helping you get better sleep. So try to keep to a regular bedtime and waking time. get into a good routine so that you're naturally tired at a certain time at night and you're waking up at the same time in the morning. You should start feeling more refreshed if you're getting a good routine. Keeping your bedroom dark, cool and quiet will create a restful environment, again, aid you sleeping. Caffeine, remember, it's a stimulant, so try and avoid it close to bedtime, as it can actually prevent you from getting to sleep, or at least delay you getting to sleep. And try avoiding using smartphones or electronic devices before bed as well. These devices emit a blue light, and this has been proven to cause problems getting to sleep. There's quite a lot of research, I think, around particularly children playing on games and it affecting their sleep. Also, you could try meditation before bed. This can help to clear your mind. It helps to relax you. I often listen to a meditation podcast before bed, and I find when I do this, I relax a lot better and I fall asleep much quicker. Next slide, please. So now I'm going to hand you back to the lovely Jaime, who's going to talk to you about creating routines.
Hi everybody, thanks for that, Kathrin. So one of the most important parts of your journeys will be just to get a good stoma care going, routine going. Following, and as you can see from here, following a study asking for patients' feedback, we found that people had a 50% reduction in the amount of time they coughed when switching from their existing HMEs to the Provox Life range. Next slide, please. And one of the best things you can do to create good habits with your routine is to create good habits with your routine. And research shows it takes around 66 days to fully form a new habit, especially one that's so different from what you're used to pre-op. Next slide, please. I found in my time in this role so far is that people always remember their routine better when they keep their products, such as their base plates and HMEs, near their other daily routine things, such as their toothbrush and toothpaste, next to the sink or at their dressing table, where their hairbrush is. And try to allow yourself time to perform this new routine and get the routine perfected, and try not to rush it so you get the best out of your HME and the best stick up your base plate. If you feel frustrated at all, just remember why you set this goal in the first place and why this routine is so important for your overall health. And the next slide, thank you. Wearing HME 24 hours a day is so crucial to your lung health and in turn the quality of your life. If you're wearing a HME 24 hours a day and coughing less, you'll feel better, ultimately feel better, and trying to get out and about, connecting to loved ones will help aid your mental well-being as well as your physical health. And just remember, like, it's all connected, your mind and your body. So HMEs, moving on to HMEs now. Atos offers lots of different HMEs as part of the Provox Life range. They are pretty much what it says on the tin, to be honest. We've got the home, which is when you're at home, when you're sitting down, relaxing. Then you've got the go, which is when you're going out of the house, just normal activities. The protect, when you're going out the house, protect is got an antiviral and antibacterial filter. Sorry, I got a bit stumbled over my words then, which will protect you from viruses. So it's really, really great for going to the supermarket or going to hospital appointments where there's going to be more people around. Then you've got the energy. I've got some patients that use it for playing golf or cutting the grass, for example. So it's when you're getting your heart rate up a bit more. And then we've got the for anybody using the hands-free devices, we've got the hands-free HMEs as well. And another study that we did, we got feedback from people, and they said that 98% of people said that when they tried the Provox Life range, they preferred it to what they were using previously. So that was with early adoption of that Provox Life range. And on the next slide, we've got some really good feedback from people about the range of products. And as you can see, people are sleeping better, which is really important to overall health. So yes, and what I'm going to do now is just hand over to Kathrin, who's just going to do the next bit of the slides and another poll.
Thanks, Jaime. Okay, come up. So for our last poll today, we'd like to ask if you think you might change your HME habits after what you've heard from us today. although I think a lot of you actually are wearing Knight HMEs anyway, but for the few that aren't. Okay, should we have a look at what the results are showing? Okay, so we've got somebody is going to consider trying wearing a HME at night. Someone else going to consider trying using HMEs for more hours during the day. Quite a lot of you, as I expected really, already have a good routine, because 71% of you are already wearing a HME at night. So, and nobody says no. So, you know, hopefully you've had some useful information today. We have the next slide, please. So just before we move on to the next part of the webinar, where we answer your questions, as always, we'd like to remind you of some of the support resources which are available to you. So if any of you are struggling or need some extra support, please don't forget that you can contact your clinician at the hospital, who can address any of your worries or concerns. And as a customer of Atos Care, you also have access to our customer care team and nursing team, who are on hand to answer any of your questions. Also, by attending these webinars, you can ask questions to the presenters and get comments. People do make comments in the chat, so you can read those as well. So they're a great resource. Next slide, please. So there are also several head and neck support charities, such as the Swallows, the National Association of Laryngectomy Clubs, Macmillan and the Samaritans, and also other charities are available to offer support as well. There's quite a few listed on this slide. And if any of you would like this information sent out to you, we can email it out following this webinar. Next slide, please. Okay, so it's question time then. So please feel free to enter any questions that you might have into the chat or the Q&A box at the bottom of the screen. We've also had some questions sent in ahead of today's webinar. So I think what we'll do is kick off with those. So Jaime, I'm going to ask you some questions. So what makes the night HME different to the daytime HME?
This is actually quite a common one we get, to be honest, and it's just that the night HME has greater humidification because it's got like a slightly larger foam inside, which gives more moisture overnight. It's also more comfortable, so it gives it more of a comfortable night's sleep as well.
Brilliant. Is there any benefit to nebulizing before I go to bed?
Some people with laryngectomies find it beneficial to nebulize before bed. However, this is something you need to discuss with your clinician, as they know your medical history and sort of the products you're using and things.
Brilliant, that's right. This person's saying, if I usually sleep with an open stoma, how long will it take for me to notice a difference once I begin using HMEs at night?
So for a greater result, it is more effective to wear a HME 24 hours a day, 7 days a week. When starting to wear HMEs 24/7, so if you were just using it in the day and then you're starting to wear it at night now, so that change, you might notice an increase in coughing and mucus for the first few weeks. It's perfectly normal. It's just the HME doing its job by increasing your lung function. After about 2 weeks, you should start to see a reduction in the coughing and your mucus production. If you are still getting some problems with your mucus and things, though, it is best to speak to your clinician about this, just to see if there's anything else going on or if there's anything we can change or do differently.
Amazing. And what do you think this person's saying? Is it better to sleep laying flat or more upright?
This is different for everyone. Some people find it more difficult to lay completely flat post-op without an increase in coughing and do prefer to sleep more of an angle, but others find it perfectly fine to sleep flat. So it's all completely dependent on the individual person.
I'm just going to go to one of the live. Rosamond has it's more of a statement really than a question. So she doesn't wear anything at night. She can't breathe at night with the HME. So yeah, everybody's different, Rosamond. So you know, if you've tried it and you can't use it, you know, either stick with what you know or speak to your clinician to see if they've got a suggestion of another product that might suit you better at night. Next question then that was submitted prior to today. So how can I talk better when wearing their night HME? I have heard actually quite a few people do struggle to voice, or the voice isn't so good with the night HME. So how can they talk better?
So with the night HME, how it's different to the daytime or the other HMEs is it's actually got two holes on either side. So instead of pressing the button at the front that you'd normally press to voice, there's two sort of holes on either side. So if you just occlude, so just block those holes with your fingers, and then you should be able to voice. People do find their voice isn't quite as strong with this HME, and some people do struggle to voice with it. But if you're wearing it at night and you do need to voice, just occlude those holes and you should be able to voice.
Brilliant. Yeah, and I've heard this one before as well. So I've got very sensitive skin and prefer to only change my base plate once a day at the most. I've tried the Luna, but the HME doesn't fit my base plate.
Yeah.
So what might be going on there?
Yeah, this is definitely quite a common one. So within the Provox Life range, all of the HMEs fit the base plate, so you can say it's really good to protect it for protection of your skin. So you're not sort of changing different base plates for the HMEs. All the HMEs fit in all the base plates. If you prefer, for example, you know, the night base plate, you can wear the night HME with that, the day HME, and any of the HMEs. So they're interchangeable. So it's much better for your skin overall.
Yeah, and I think it's worth bearing in mind, well, remembering as well that if you were using the Provox HMEs and base plates and have moved over to the Provox Life, or you're using any other base plate and HME, then you can't interchange those HMEs and base plates with the Provox Life ones because of the slight difference in size. So the Provox, like you say, Jaime, the Provox Life ones are all interchangeable between that range, aren't they? Next person has quite a lot of difficulty in getting their base plate to stick and would like some tips, please.
So this has, as we mentioned before, about getting the good routine going. I'm not sure what base plate you're using at the moment, but if you just make sure when you are, so when you're removing your base plate, just make sure you're cleaning your neck of any debris or any sort of mucky dried secretions or anything when you're removing that old base plate, and allowing the skin to dry completely. After the skin's dried completely, just make sure whichever barrier that you're applying, whether it's a cream or a wipe, just wait for that to become a bit tacky. While you're waiting for that to become tacky, because that creates a really lovely film and protects your skin. What you could do is, or what we advise to do, is to warm the base plate in your hands or underarm or wherever you prefer to warm it for a few seconds, and this kind of activates the glue, or just helps to activate. After you've done that, when you're popping like in the video with Louise, make sure the ring part in the middle of the base plate is applied first. So pop that, a good bit of your stoma, and then work your fingers from the inside out all around. Make sure you've got a really good seal, and then make sure after you've applied it, make sure it's as flush to the skin as possible, that middle bit. And when you've applied it, just wait for around 30 to 45 minutes before voicing, just to ensure that glue is dry. Or you might have problems with your base plate blowing off, or getting air bubbles around there, and then you might struggle, or you'll struggle with your voice production then. So it's just ensuring you've got that really good routine.
Yeah, that's some great tips there, Jaime. Thank you. I think that's quite a common thing that people forget, don't they, not to try and voice for a good half an hour, 45 minutes, because it just, by voicing that starts to weaken the base plate before the adhesive's even stuck properly, doesn't it? So,
exactly. And then trying to voice and then blowing off, and sort of that frustration of not being able to voice them. But it's sort of, if you can get that down, it's quite a good sort of, not simple solution, because some people struggle, but it's quite a good solution to that problem.
Yeah, so we've got one more question. I can't see any more questions popping up in the Q&A, so just to remind people, if you have got something that you'd like to ask myself or Jaime, please pop it in the Q&A We're more than happy to try and answer it for you. But the last question that we've been sent in, this person always wakes up with thick and sticky mucus and their voice isn't as good in the morning. What can they do?
Oh yeah, so morning can be quite a tricky one for some people, definitely. And I'm not sure if you're already wearing a HME at the moment, or what you're sort of doing with your stomy routine, but wearing, as we've mentioned before, wearing a HME 24 hours a day, 7 days a week is so good, and it really helps with keeping that mucus really thin and more manageable. Some people, as we mentioned before, some people do nebulize before going to bed, and then when they wake up as well, and some people do find this helps to loosen their mucus. I'm presuming from your question that you have a voice prosthesis or a valve, and you need to just make sure you're keeping that nice and clean, and cleaning that at least twice a day, especially after eating and after having a nebulizer. Just give it a clean after a nebulizer, because that can sometimes get blocked up with your mucus and then cause issues with speaking then as well. So just make sure you've got that good routine going with your valve as well.
Definitely some great advice there. Thanks, Jaime.
You're still having problems, and again, like, just make sure you're speaking to your clinician about it, because it might be something really simple, or something that they can help with, or just to help with that voice and mucus.
Right. Eric types, not a question, but he uses silicone glue. I think, Eric, that might have been in response to the question prior to this one, about getting the base plate to stick. I know some people do. They do actually use additional silicone glue, and that's great for some people, but obviously you would need to check with your clinician first to check that it's suitable for yourself. And Alex has asked something similar as well, so asking if the glue is a safe product to use over a period of time on the skin, as they're using hands-free. So again, with any new product, what I would recommend is doing a little patch test first. So whether that's on your arm or just on the side of the neck, put in a little bit, whether it's the base plate or a bit of silicone glue. But again, speak to your clinician first before you start using anything new, just to check that it's appropriate for you. If you are going to use it, as I say, suggest just a little patch test for 24 hours, a little bit like you do, if you were going to get your hair dyed for the first time, or your eyebrows dyed for the first time, just to check whether you have any reaction to the product. Just a little tip really, and see how you go with that.
There's someone on the chat as well, Kathrin, that's just I don't know if you've got any comments on this at all, or that's just said that they use the Energy HME in the hot tub. Is that something that do you have any sort of comments on that at all, or no?
No, I'm wondering if they use it because of the heat, or the like, you do get a little bit of vapors or steam, don't you, really, when you've got the bubbles going on a hot tub. So maybe Ivan finds it easier to breathe using that. Obviously we wouldn't advocate getting into water or anything. So yeah.
I can't see anything. I can't see any questions at the moment. I don't know if anybody else has got anything for us at all, or maybe you've had a question and we've kind of answered it with someone else's question, possibly.
We can wait a couple of minutes and see if any more questions come through. But just to let you know that we are actually repeating this session again next Thursday. So that's the 21st of October at 2 o'clock. So if you think that you know someone who might benefit from it, please point them in the right direction, and point them to, I think our marketing team have actually put the link in the chat function as well for finding our events, so they can register for that. But also on the 28th of October, we're holding a patient experience. So anybody that's attended one of these before, that it's a much more interactive session. And we've actually got somebody coming, I can't remember where they're from now. It's the sleep, it's escaped my memory now, but basically it's somebody who's an expert in meditation, and they're going to come along, go through, thank you, Hannah, the Sound Asleep Club. I got one word right. So they're coming along. They're going to go through some sleep rituals and also do some meditation as well. So that sounds like great fun.
Good.
So we'd love for you to join us. And again, the link is in the chat if you'd like to find out more details about that or register for that event.
We've just had on the Q&A. I'm not sure. When someone's asked how long do you have to wait for a base plate, I'm assuming that's after. Do you mean post-op? David from David Jones. I'm not sure if he means post-op.
Yeah, I'm not quite sure about that one. There's a few ways that one could go. So I don't know whether he means how long do you have to wait for it to stick.
Maybe.
So as Jaime was talking about earlier, once you first apply your base plate, try not to voice for 30 to 45 minutes to, just to help that glue stick to the skin more efficiently.
Yeah.
I don't know, maybe David could, if he's still with us on, maybe he could just try and clarify what he means by that question.
Yeah. Give him a few seconds to type unless we've answered it, maybe.
Anybody else got any questions for us while we're here?
Sorry.
Rosemary's asked how she can get a speech valve that doesn't leak around the outside. So Rosemary, this is something that needs to be taken up with your speech therapist, I'm afraid. There are products out there that can be used in conjunction with speech valves. If your speech therapist would like some more information about these other items, then please ask them to get in touch with their territory manager for their area, or they can contact customer services, who would be more than willing to help.
Perfect. Okay. Hang on, I think we've got another.
Okay, David's had his ops this year. So, David, it all depends. All hospitals have different ways of working, and some will start using base plates straight away, straight after surgery. Some will opt for using a tube and then move on to base plates further down the line. It all depends on what your situation is. Your clinician will know obviously more about what stage you're at and when they're going to be thinking about talking about base plates with you. So my advice would be to have a chat with your speech therapist or your specialist nurse to see what what they're thinking, what their plans are for you starting to try with base plates.
We've just had one more come up in the chat for Kathrin, if I can just ask you, what can I use at night if the Knight HME doesn't help her? So from Rosamond.
So at night there is there's the Provox Luna. I don't know whether you're using the Provox Life products already. Are you wearing a HME during the day, Rosamond? I'd be interested to find that out first, I think.
So we'll just wait.
Everybody's different. Some people, as I was saying earlier, some people can't tolerate the HMEs overnight for whatever reason. Some people might wear, if it's just that they can't tolerate the specific nighttime one. Okay, so you're wearing a HME during the day. So you could even try wearing the daytime HME overnight, because any HME is better than none, because any HME is giving you that humidification overnight. So if you've just got an open stoma, your humidity in your lungs drops quite dramatically, and if it goes below 30%, the little hairs that move the mucus around inside your lungs, they actually go to sleep. They become dormant. So when you put your HME on the next morning, you might start coughing more because the humidity is increasing in your lungs and your little hairs are waking up and starting to do the job that they should be doing. So you could try wearing your daytime one overnight and see how you get on with that. But again, if you're unsure about something, I would recommend that you speak to your clinician for further information.
Brilliant. Thank you for that, Kathrin.
No problem.
Has anyone, we'll just give a couple more minutes. Shall we just see if anybody else has
Sure,
any?
sure.
Rosamond says she'll try that. Thank you.
Brilliant.
Brilliant. Hopefully that you'll get on well with that, Rosamond, and things will hopefully improve for you.
I'd be interested. I think Rosamond's been on these webinars before. I recognise your name. So I'd be interested to find out how you get on with that, Rosamond, if you could let us know.
She hasn't had the pleasure of seeing me yet then.
Thank you. Well, just while we're waiting to see if there's any more comments or questions coming through, before people start dropping out, at the end of this webinar, when you leave the webinar, we'll be putting up just a very quick survey. If you wouldn't mind taking part, it'll only take you a few seconds just to complete that. We would be very grateful if you could do that, please. Okay, I don't think there are any more questions coming to you by the looks of it.
If you do think of any more, I think either your clinician or probably maybe pop us is there contact details on the presentation, Kathrin? Sorry, I didn't.
Yeah, there was the nurse's email address, wasn't there? We can send out, or you can contact your customer care agent, who can send your question over across to us nurses, and we can get in touch with you after that.
Perfect. Look at Hannah's on the ball.
So nurses@atos-care.co.uk.
Perfect.
So I don't know that one off the top of my head because I'm not emailing that one, funnily enough.
No, me either. But if you think of anything sort of afterwards at all when the webinar's ended, you can always join us and see our lovely faces again next week, or pop their message over to that email, or like Kathrin said, contact your customer care representative. Brilliant.
And don't forget the sleep experience on the 28th as well. So Sam, our clinical educator, will be hosting that, as I say, with a guest speaker.
Brilliant. Thank you so much, everybody, for joining us. It's been really, really lovely. I hope it's been as lovely for you. And we'll hopefully see some of you next week if you think of anything else at all, or we'll see you at one of the other webinars or experiences.
Thanks for joining us and for sending your questions in. Thank you.
Thank you so much. Thank you, everyone.
Bye.
Bye.